Welcome back to Body and Soul, everybody. Season 9. Let's take charge of our health. I've been waiting to do this topic for so many years now. It is the third most common cancer amongst men in Singapore. 2 cases are discovered per day. That's the estimates. Prostate cancer. And yet so many men ignore this situation. Professor Lam, welcome back to the show. Thank you for helping me explain this. It's very important, I feel.
It is, especially because it's so common, but people don't want to talk about it. This is what the show is about. We need to talk about it because when we understand it, we can detect things early, treat things early, even prevent things.
That's right. Don't be shy when it comes to your prostate health. We need to understand how the prostate cancer forms first and foremost. Professor Lam.
All right, let me show you first and foremost what the prostate is. Now, the prostate is just a walnut gland at the bottom of the bladder in front of the rectum, and what it does is it contributes to the seminal fluid that nourishes sperm. What happens in cancer, however, is that the cells of the prostate start to multiply uncontrollably because of a mutation in the DNA. Now, so it gets bigger and bigger. That's when it presses on the urine tube or the urethra, and it could even break into blood vessels and then spread to the rest of the body. The complications then become incontinence or erectile dysfunction. But that's the complication later.
We've always talked about how important early detection is for most health issues. Is that possible here, Professor Lam?
Yes. Now, that's an important thing. Prostate cancer is one of those cancers that you can actually detect even before symptoms with a blood test. And that's the prostate-specific antigen test. Now, I'm not saying everybody needs to do it. You need to know your risk factors. And what are they? If you're older or if you have a family history of prostate cancer. Now, I still, though, have to talk about the early symptoms if you have them. The problem is, it's things like difficulty passing urine, a poor stream, waking up at night to go to pass urine. And many older gentlemen will have this and, of course, say, it's part of aging and ignore it. So don't ignore this.
Absolutely. That's what makes the problem worse. Don't chalk it up to aging. There are so many treatments available. Coming up, I'm going to walk you through a surgical option that involves needles and freezing. It's quite phenomenal. For the right person, it is absolutely life-saving. We'll talk about that on today's edition. But first, as Professor Lam talked about, the regular screening that happens. What is that actually like? Let's find out.
A blood sample is the first step of a prostate examination, after which the results can show you whether a patient is at risk of prostate cancer. Now, the thing is, prostate cancer can often be symptomless, okay, and can take years to develop. So according to the Health Promotion Board, there could be thousands of men walking around every year with prostate cancer and they don't even realize it. So you might be thinking now, how do I test for it? Well, that's why I'm here. Let's go join the expert to find out. So Dr. Peng, what is the age that men should come in for a prostate exam?
Well, we recommend that men above 50 should come in for a prostate examination. However, in some men, for example, those who have a family history of prostate cancer, meaning their brother or their father had prostate cancer, we would recommend that they come in even earlier, maybe at 45 years old.
So what is the process of a prostate exam?
First, the doctor would take a history, ask them about risk factors for prostate cancer like family history. And the next important thing we do is a prostate examination, where we insert a finger through the anus to feel for the prostate gland. The doctor is actually feeling for the size of the prostate, as well to feel for any hard nodules on the prostate gland that may indicate prostate cancer. Next thing we'll do is to do a blood test. This is very important. We are testing for a prostate cancer marker called the prostate-specific antigen, or the PSA. The normal value is between 0 to 4, so men whose PSA is above 4 would be at risk of prostate cancer.
And then what is the next step after that? They find out that the patient is at risk.
So these men who are at risk for prostate cancer, we will recommend a prostate biopsy. At the same time, we will also recommend an MRI of the prostate. The MRI is what is known as the multiparametric MRI. This is a very sensitive imaging modality where it can see suspicious area within the prostate gland. If the MRI showed any suspicious areas, we will do what is known as MRI-targeted prostate biopsy, where we superimpose the MRI images onto the real-time ultrasound images of the prostate, and we do targeted biopsies of the prostate gland, therefore increasing the chance of detecting prostate cancer.
So Dr. Peng, why would some men be reluctant to come in for a prostate exam?
Yeah, I think some men are reluctant because they are afraid of finding out that they have prostate cancer. And another reason I could think of is the prostate gland is in a very private area of men. So they may be afraid of having procedures or examinations done to that part of their body. So maybe that's why they're afraid of coming forward.
So I hope this entire process has been demystified. So guys, above the age of 50, if you're watching, remember, please go for your regular checkups.
Coming up, our celebrity guests break the ice about their prostate cancer concerns. Find out who they are and what this treatment is all about next on Body and Soul.
So we've talked about advanced technologies to treat cancer. But what about technology to prevent cancer? Guess what? We have such technology to even vaccinate ourselves from some form of cancers. But the most exciting potential is that technology that made possible our COVID-19 vaccines, and that is the messenger RNA technology. You see, messenger RNA vaccines teach our cells how to make a piece of protein, or even just a little piece of the protein that triggers an immune response inside our bodies. As a traditional COVID-19 vaccine, it primes our body's immune system to recognize and attack the viral cells. But in the same way, a cancer vaccine can teach the body's immune system to recognize cancer cells, either to prevent cancer from returning or even to actively seek and destroy tumors in the body. Isn't that interesting? That was your MedTech Minute.
They're here to ask the questions that need to be asked about prostate cancer. Welcome to Body and Soul, our guests, actor Madhyalagan and musician-actor Mel Ferdinand. Gentlemen.
Hello.
Hello, Daniel.
So good to see you all, guys. Thanks for coming back to the show.
It's a pleasure.
First time on the program as well?
Yes, thank you for having me.
I'm sure our viewers are wondering, for a topic like this, why are two gentlemen like you here? Have you had some personal experience with prostate cancer? Madhy, let me start with you.
Okay, not personal experience actually, but I'm reaching 56, so people are talking about, I've hearing so much about prostate cancer and it affects only men, of course. So I would like to know more about it. Yeah.
But had you known anything about it prior?
Very minimal.
Yeah.
I play only the doctor on screen, but no medical training whatsoever.
Mel, how about you? What brings you here?
Well, as Marty said, when you get to a certain age, you start to confront certain things that could be a problem for you. And there's lots that you read about, but it's nothing like speaking to an expert to find out.
Yep.
We've got the experts on this show, that's for sure. I'm so glad that men of a certain age want to talk about this. I face this problem on the radio show. People don't like talking about it, especially, macho men. They don't want to.
I was exactly going to say that, Daniel. I was saying, look at these gentlemen, striking, charming, and then willing to just talk about these issues here. I applaud you, first of all, and you are absolutely right. We have this rule of thumb in medicine. We say 80% of men after the age of 80 are going to have prostate problems. And the issue is they often die with the problem rather than of the problem, which of course then makes everybody not take it seriously. But I think we need to talk about why it's still important to take it seriously.
For sure.
But that's part of the problem, isn't it? Because it could be asymptomatic.
Yes.
And because it doesn't really affect quality of life necessarily,
Okay.
people ignore.
When you say asymptomatic, are there no symptoms at all that can indicate that someone has to worry about prostate cancer?
Very, very good question. Can I ask you a question?
Yes,
Do you
of
get up
course.
at night to pee?
Yes, I do. I don't remember it half the time.
All right. So you see, that's the problem with prostate issues sometimes, that the symptoms are things like getting up to pee at night a bit more often, little bit more difficulty passing urine, a little bit of a stream that becomes poorer. These it's not like blood in the urine or something obvious like that. And so people tend to ignore it.
Put it down to old age or,
Exactly.
It's perfectly normal for these things to happen, right? Is it only urinary problems that tend to be some of the symptoms associated with this?
Well, that's the most common early on. And then, of course, in a later stage, you could have blood in your urine and so on. But these things can also be because the prostate is just enlarging. But that enlargement, while we are most worried about cancer, can also be a benign enlargement.
So, gentlemen, we just saw what it's like to go for a test, a regular test for somebody that doesn't have symptoms necessarily. Would you consider going for that kind of regular check where a digital rectal exam might happen, doctor might check you up a little bit more?
Of course, I mean, knowing, I think basically it's about knowledge. I mean, if we know there is no big deal, getting your rectum checked, a prostate checked for prostate cancer, I think it's no big deal. I'll be open to that, open to it, of course.
Yeah, Mel, what do you think?
Well, definitely for sure. If you want to, you want to make sure that you're in the pink of health. What I was going to ask, doctor, was at what age would someone, a male, start to think about doing?
Yeah, require. You said something about 80 and all that. Is it too early for me to?
Yeah, no, okay. So there are some general guidelines that people say, gentlemen, as they reach the age of 50. However, if you have a family history, and especially if that person in your family has prostate cancer at an earlier age, you should start screening earlier, for example. And it's also, controversial still whether every single 50-year-old, the minute you hit it, you need to do this. So the rough guide is 50 years old.
Now, when it comes to treating prostate cancer, it's also very interesting because I know that for some individuals, watchful waiting is the recommendation. So doctor might monitor you, but no treatment. And you live your life as the prostate cancer progresses slowly. But for some men, surgery is actually required as well. Do you think men are also afraid of prostate surgery?
I think myself, I'm more worried about, because it's cancerous, it's prostate cancer, right? So would it also entail radiotherapy and all that stuff? So that would be more frightening for me than just surgery.
Well, I think the other issue is with cancer, any kind of cancer, there's always the different stages, right?
Yeah.
And whether how aggressive it spreads and stuff like that. So if you can, sort of nip it in the bud, why not?
Yeah,
right.
Literally.
However, what I think is as well, coming back to your question about surgery, I think, there's already a lot of men who face this sort of indecision about going for the test in the first place, and for whatever reason, sometimes there might be a certain taboo, a certain mindset that, real men don't go for tests and things like that. So maybe if we can overcome that.
Yeah, good point. Let's get rid of that stereotype. No more of that. Body and Soul wants to erase it. Great points raised by our guests about detection and surgical options. Coming up, our expert's going to walk you through that, plus a new technique that could freeze your socks off. It's up next on Body and Soul. Stay tuned. It's Body and Soul demo time. Our celeb guests, Mel and Madhi, joining us on the examination table. Gentlemen, you have amazing questions, and I want to make sure you get the right answers. I've invited Professor Tay onto the show. Good to talk to you again, Professor Tay.
Thanks for having me.
Now, we want to start off with Madhi's question. I was so fascinated by his point. Madhi, what do you want to ask?
Doc, there's so much talk about prostate cancer and all that. But few years back, I barely heard about it. So I'm wondering, is it a case where more people are getting prostate cancer, or more people are being identified because there's more testing?
I think it's a combination of both. And I do think that prostate cancer incidence is rising over the years. One of the reasons is because of our aging population. More men are getting older, healthier, into old age. And so that's when they start developing prostate cancer and having that detected.
What is the recommended age for men to start testing? And what's the frequency that they should go for tests? For example, if I go for a test now and I'm given the all clear, would it mean I'm safe for another 3 years or something like that?
Usually the recommendation is to do a yearly or 2-yearly test. And from the ages of 55 to 70, after a discussion with your physician, and that's if you are asymptomatic, that means you have no symptoms at all. Because if one has symptoms like difficulty urination or blood in the urine, one should get evaluated immediately at any time that occurs. Now, if one is asymptomatic and has no symptoms, there is a discussion about the risk of overdiagnosis and overtreatment, because prostate cancer takes a long time to develop and to grow and spread. So that means that only a man who is healthy with a long life expectancy would benefit from testing. And that's where the discussion comes in.
Right. So that's testing and, of course, screening options. But what about treatment? What's the treatment approach for prostate cancer?
Well, there are a lot of treatment options. And in my practice, about a third of the men go for active surveillance, which means that their cancer was very minor and was safe to be monitored and had a low risk of developing even over a 20-year horizon. But the standard treatments for those that have more aggressive cancers are total surgical removal, which we typically use the Da Vinci robotic surgical technique, as we can see in the video here. Another option is radiation therapy. And here we can see the prostate gland. That's just between the bladder and the urinary outlet. There are many critical structures around it. So using the Da Vinci method, we have a minimally invasive way of peeling off these critical structures. As you can see here, the bladder is being separated from the prostate, and here the nerves that allow erectile function are being peeled away from the prostate. Now, even though we are very careful and with this very minimally invasive technique, there's still a significant risk of side effects. Those include erectile dysfunction and also urinary leakage, because the mechanisms for control of urine are disrupted.
See, Prof, that's the problem. If a gentleman hears that the side effects of dealing with it means urinary incontinence or erectile dysfunction, maybe they'll think to themselves, no thanks, I won't do the surgery.
And live with it, yeah.
Live with it, just live with the problem. Is there a better option?
And that's one reason why we are pioneering the focal cryotherapy program in the Singapore General Hospital, which is the first in Singapore and first in the region as well. If the cancer only resides in one portion of the prostate, can we not just destroy that area of cancer? And here's where we put in needles that can freeze that area and destroy those cancer cells in order for the man to be rendered cancer-free with minimal side effects.
Freezing for your prostate cancer. Gentlemen, what say we have a look at how it's actually done?
Okay, sure.
Looking forward.
Okay, let's take a look at this, guys. Assume that this kiwi is representing a prostate, and the area of cancer is just over here and not anywhere else within the prostate. And you see that I've already pre-placed 2 needles over here into where I think the tumor is. I'm going to show you how I'm going to put in the 3rd needle right over here.
So you'd have mapped this out already in advance,
Oh,
right?
yeah. We do a very detailed imaging with MRI and also a very detailed robotic biopsy in order to find out exactly where the cancer is. We don't want to miss it out and find that there's another spot somewhere else. Let's start freezing now at 100%.
Is this a painful procedure, Doc?
Well, it's usually done under general anesthesia. So the procedure itself, one usually doesn't feel any pain. And everyone usually goes home on the same day after that.
Compared to surgery, this is less invasive.
It's less invasive. We are only putting 3 needles in, and depending on how large a tumor is, we may have to put more or even less needles. So some patients can get away with just 1 needle put inside.
Oh, wow.
And you can look over here, you can see that the ice ball is forming very nicely just over this area where we think the tumor is. And so the rest of the kiwi is untouched by the ice. And if this were the prostate, they would remain undamaged as well. And with the critical structures that we showed earlier, the erectile function nerves that are at the side and the urinary continence mechanism, these would be spared, and this minimizes the side effects for the patients.
That is so targeted and so specific, but I do want to emphasize once again, that's not for every prostate cancer patient, is it?
Exactly. It's only appropriate if the cancer is in a single focus within the prostate so that we can target it and destroy it. If the cancer in many areas of the prostate, which is what we would term multifocal, one would be better off having the whole prostate removed or undergoing irradiation therapy to the prostate, for example.
Professor Tay, what a pleasure. Thank you so much for showing this to us. And of course to our celebs. Great questions, gentlemen. I hope you're feeling more confident about your prostate health now.
Yes,
Definitely,
yes.
and thank
more
you for
confident.
having us.
And if there's treatment to be done, we are more confident now as well, knowing all this, right? Yeah.
Thanks, guys. Appreciate it.
Thanks, Daniel.
I'm so glad we got to tackle prostate cancer on today's episode. Now we can all talk about prostate health openly and honestly with our doctors, with our family members. Professor Lam, what do our viewers need to remember about today's show?
It's exactly that, first and foremost. There's no health topic that should be taboo for us to talk about, because when we face it, we realize it's not that scary, and the take-home message is simple. Number 1, know your risk. Number 2, if you're having symptoms, don't go and ignore them. Please see your doctor and get screened. There's nothing to be scared of. And then the third thing, remember that treatments, even if you have advanced so much, they can be minimally invasive, they can be really targeted.
We've got so many amazing episodes of Body and Soul for you to catch up with right now. Head on over to MeWatch for all our previous seasons. And we've got exciting topics lined up for the rest of Season 9. Make sure you join us again, same time next week, for Body and Soul on Channel 5. Bye, everybody.